Assalamu alaikum, everyone. Ramadan Mubarak. I wanted to start by thanking ICNA Relief for having me. And I hope to, inshallah, teach everyone some healthier ways to navigate this Ramadan, navigate iftar and suhoor, and inshallah, ways to reduce inflammation because we tend to have inflammatory foods during Ramadan. So, reduce inflammation to optimize our physical health, which will in turn optimize our spiritual health this Ramadan. So, hopefully, you've been making some good choices. Inshallah, after this talk, you'll be making even better choices. So, again, my name is Dr. Kazi. I'm a board certified family medicine physician. I focus on lifestyle and obesity medicine to help people lose weight and get off of their medications, reducing reliance on our healthcare system, which I kind of touch on over here. It's a broken system, and I'm hoping to teach people how to change their lifestyles to reduce the amount of medication that they're taking to improve their underlying health and reduce the amount of times you have to go to the doctor or hospital or urgent care. And inshallah, we can implement these changes this Ramadan. Just want to start off with a few facts. So, the United States, we spend so much when it comes to healthcare. So, our spending is this very top line, and the rest are the rest of the developed countries. So, our gross domestic product, we're spending 17.8%, and the average is 9.6%. As individuals, we're also spending almost three times as much as Koreans and Japanese when it comes to healthcare. And this includes our health insurance and medications and copays. Unfortunately, despite all this spending, we have the worst life expectancy out of all the developed nations. We have the highest rates of obesity and then the highest rates of chronic disease. So, United States, unfortunately, we're riddled with chronic disease. Um, I want to highlight this fact over here that 88 million Americans have prediabetes and 90% don't even know it. So, it's important to pay attention to your body. If you're noticing that you're gaining a significant amount of weight, or you're noticing symptoms such as thirst or excessive urination, to get evaluated for prediabetes. The good news is you can make lifestyle changes to help prevent and reverse prediabetes, which will in turn minimize your risk of developing diabetes. This slide, I'm just highlighting how our healthcare system, what it looks like today. Basically, you go to the doctor and they basically treat numbers and symptoms. You go home, come back 6 months later, only to repeat the process, and we just don't get any better. The good news is there is so much in our power in terms of lifestyle changes that we can make to significantly reduce disease burden and significantly reduce the risk of developing chronic disease. And the reason I hone in on chronic disease is most of us will end up with a chronic disease if we aren't proactive. We'll end up on several medications. We'll end up having to go to doctors and specialists and hospitals and urgent cares if we don't take control of our health and what we're doing. Another benefit to honing in on our lifestyle is lifestyle medication or lifestyle medicine actually follows the sunnah. So essentially, by making these changes, you're not only improving your physical health, but you're following the sunnah and getting barakah from that as well. So, what is lifestyle medicine? Lifestyle medicine hones in on 6 areas: exercise, nutrition, sleep, avoiding smoking and drinking, stress relief, and community, which in turn greatly improves our underlying health, which allows for less medication, less doctor's visits, less hospital visits, and less ER visits. In turn, that means more money, higher life expectancy, and better quality of life. Now, because it's Ramadan, I wanted to focus in on nutrition, and so we'll go through what our eating habits look like right now and how we can change them. So the standard American diet, just doing a general overview, 63% of Americans' calories come from refined and processed foods. So packaged foods, fast food, junk food, chips, cookies, crackers, 63% of our calories are coming from these types of foods. 25% comes from meat, animal-based foods, and then 12% come from plant-based foods, but half of those are from French fries. And French fries, they are not healthy. We should be seeing 63% of our calories from plant-based foods to really optimize our health. What is a processed food? So, a processed food has been manipulated in some way. It's been taken from its raw form and changed. So, chopping it, washing it, cleaning it, canning it, freezing it, drying it, dehydrating it. Those are ways that we process our food. And there's a spectrum. You go from minimally processed, which is like an apple that you've cut, to ultra processed. You've turned apple into an apple pie. You've added a bunch of fats, starches, sugars, stabilizers, chemicals, preservatives. So that's when you get to the higher end, or the, I guess, the worst end of the spectrum, when we're looking at processed foods, and that's where you've hit the ultra processed foods. Now, they are cheap, convenient, and tasty, but ultra processed foods have been found to be as addictive as smoking and can lead to obesity, type 2 diabetes, cancer, heart disease, depression, and anxiety. And here is a picture, showing some examples of ultra processed foods. Yes, they're super colorful, and you find them in a can, so it's really convenient. But again, these are very inflammatory in nature. It's leading to these types of chronic diseases. So we need to hone in on, focus more on getting healthier foods in our diet. And the good news is, whatever damage has been done by ultra processed foods that you've eaten, we can reverse that damage by eating more healthily. And there are several studies that look at how healthy eating can impact our health. There was a nurses study done, and this was done on over 100,000 nurses. They broke them into two groups. One group had an ultra processed diet, the other group had a plant predominant diet. The ultra processed diet group was 9 times more likely to develop diabetes versus that plant predominant diet group. The World Health Organization has also stated that 80% of all heart disease and stroke and 40% of cancer can be prevented by eating healthy. And then the CDC has a long list of benefits from eating healthily. Now, I also wanted to mention the blue zones. These are 5 cities in the world where people live the longest, healthiest lives, and one commonality is they have a plant predominant diet. Now, what is an example of healthy eating? When you are grocery shopping, try to load up on fiber rich foods. Americans get less than half of what's recommended in terms of fiber in our daily diets. So, load up on fruits, vegetables, whole grains such as oats, quinoa, barley, whole wheat bread, popcorn. Rice is a processed food. So, white rice is a processed food. So, all of the nutrients have been stripped from that rice, and what you're left with is basically a simple carbohydrate that dissolves very quickly in the body and causes a rise in your blood sugar, which in turn can causes an increase in your insulin, and that can lead to insulin resistance. So it's no wonder that some of the countries, such as Pakistan, for example, has the highest rate of diabetes in the world. And in Pakistan, we do eat a lot of rice and bread, and so that does contribute to that fact. Other fiber rich foods are nuts and seeds. So, again, grocery shopping, try to get these types of foods in. Fiber rich foods can help maintain your bowel health. They're anti inflammatory. They help maintain your blood sugar and can not only help you lose weight, but maintain that weight loss. And they have been shown to help you live longer. Some more examples of healthy eating: choose lean proteins such as white meat, chicken, fish, ground turkey, fish and seafood. Egg whites are a great option for lean protein. And then your plant based options are legumes, tofu, nuts, seeds, and quinoa are all good sources of lean protein. Now, when it comes to lean meats, minimize red meat. Red meat it's been shown to be inflammatory, and it has a strong link to colon cancer. And we've been seeing a pretty stark increase in the rates of colon cancer in the United States. And studies have linked red meat consumption to higher rates of colon cancer. So minimize the amount of red meat in your diet. Again, stick to chicken, fish, and turkey if you need, when you're looking at your meat sources. So in general, healing foods are unprocessed or minimally processed. So yes, we may have cut them or baked them. but not fully process them to the point where you can't recognize the raw ingredients. So how do we get from our inflammatory iftars, which are full of fried foods and sugars, to eating the rainbow this Ramadan? I recommend following the way our Prophet ﷺ ate. So Rasul ﷺ used to had a plant predominant diet. He did eat mostly fruits and vegetables, including grapes, pumpkins, squash, fig, dates, watermelon, whole grain, barley. The Prophet ﷺ used to eat barley, which is a great grain. And meat, he did not eat as much meat as we do today. So plant predominant diet is following the sunnah. When you are trying to figure out what to eat for suhoor, make sure you're increasing your fiber, water, and protein. Decrease sugar and processed carbohydrates such as cereal, Pop Tarts, pancake, waffles, and white bread. These are inflammatory and they're quickly digested. So you may notice when you eat these types of foods, the next morning you may wake up sluggish, or if you take a nap after suhoor, you may wake up feeling sluggish, and you may be hungry an hour later because it's been digested so quickly. So try to get more protein and fiber in for a sustainable source of energy. And here are just some examples I listed for in terms of what to eat for suhoor: fruit, dates, beans such as ful or hummus. Vegetables are always a great option. Old-fashioned oats cooked with water or almond milk. You can add whatever you want to oatmeal. I love oatmeal for suhoor and for breakfast. So you can add no sugar added nut butter to get a good protein source. You can add some dates to it to get fiber and to sweeten it as well. Chia is a great source of protein you can add to it. Chia pudding is a good option. Veggie omelets. I recommend just using one egg yolk and the rest egg whites, and then adding a bunch of vegetables to your omelet to make it healthy and get your protein and fiber in. Ezekiel bread is a great option because it is less processed than other breads. You actually find it in the freezer section because it's not as processed, so it's not as shelf stable as other breads are. So choose Ezekiel bread. You can add some no sugar added nut butter to it, and then plain yogurt, add a little bit of honey and fruit to sweeten it. Now, when it comes to iftar, similar concept: fresh fruits, fresh vegetables, vegetables that have been sauteed or steamed or baked or air fried. Just avoid deep frying them in ghee and breading them. So sauteed or baked vegetables are a great option. If you need something sweet to drink, go for fresh fruit juices. They are much better than box juices. Box juices usually have stabilizers and sugar added to them. So fresh fruit juice. Fresh fruit smoothies are a great option as well. Soups, I love having soup for iftar. So we've had lentil soup the past couple of days, and I've enjoyed that so much for iftar. The kids like it too. Whole grains, again, barley, quinoa, brown rice. Minimize white rice. That's the big kind of take-home message on this slide: is minimize white rice. Try any one of these other grains instead of white rice, and it'll be a much healthier, less inflammatory option. And then chicken or fish as your meat. When you go out for iftar, this is what you want your plate to look like. So quarter of the plate should be meat, a quarter of the plate should be a whole grain, and then half of the plate you want to fill with vegetables. And that'll really sort of push you into getting that nice anti-inflammatory iftar. So this is a great example to follow when you're invited for iftar. This slide, I'm just kind of highlighting where to sort of sort foods in your mind. So red light foods would be ultra processed foods. And when I talk about a red light food, basically it's like imagining running a red light. You want to minimize the amount of times you run a red light. So you want to minimize the amount of times you are eating ultra processed foods to maybe like once a month even, to be honest. But once a week, I would start by cutting down the amount of ultra processed foods that you're eating by half, and then continuously, cutting it down from there, inshallah. Yellow light foods can be minimally processed foods, so you can have them more often. And then green light foods are unlimited. You can have as many fresh fruits and fresh vegetables, beans, nuts, legumes, whole grains as you want. So those are considered green light foods. And I added a couple of slides at the end here just to give options. So instead of deep frying your egg rolls and samosas, air fry them. I avocado oil spray. So I spray the egg rolls and samosas and then I air fry them. So it's a much healthier option than deep frying them. Pakoras, if you need to deep fry pakoras, use avocado oil. It's less inflammatory. Olive oil, I don't recommend deep frying in olive oil because it has a low burning point. So when you're deep frying in olive oil usually will surpass that burning point and become inflammatory as it's releasing free radicals and causes oxidation. So it can cause damage to the body if you heat it too much and go beyond that burning point. And I've touched on this already. Instead of white rice, try any one of these other whole grains that are healthier. They're healing in nature. They're not as inflammatory as white rice is. We all love our bread, but there are whole wheat options. So choose whole wheat breads when you're shopping for naan or pita bread or rotis. So again, by implementing lifestyle changes, and we only honed in on nutrition today, but as you implement evidence-based changes, you'll increase the amount of money in your pocket because you're decreasing your risk of developing any chronic diseases, increasing your life expectancy, and then increasing your quality of life as well. One last area I wanted to touch in on was community, and this is just a shameless plug. You'll find my link, inshallah. I believe it'll be sent to you. It should be available on the website. But I am starting this Muslim Women Weight Loss Academy. It's opening soon, so I would love it if you join the wait list today. I do have a freebie attached. It's top 10 ways to power you through your weight loss plateau. I can't say that, tongue twister. Inshallah, I hope you'll join me. This is my attempt at creating a sense of community to help us all instill lifestyle changes, heal from within, reduce our risks of chronic disease, and in turn, reduce our reliance on the American healthcare system. Inshallah, I hope everyone's able to implement some of these changes that I've recommended this Ramadan. I know, we've reached... we've already had several fasts, but inshallah, moving forward, you can start adding more fruits and vegetables. Next time you go grocery shopping, add those fruits and vegetables to your list and focus more on water and less on some of the ruafza and sodas and juices this Ramadan, inshallah. All right, take care. Thank you again, ICNA Relief. And if you have any questions, feel free to email me. Assalamu alaikum.